I realized that everything I knew about menstruation was basically a fallacy or a lie. Misconceptions.
Welcome to Her Body Matters, the podcast by Medical Aid Films. Today we're talking about something that affects half the world's population and yet remains covered in silence: menstruation. In Kenya, thousands of girls miss school, suffer avoidable infections, and carry deep shame, not because they're unwell, but because of stigma, lack of products, and a system that doesn't treat menstrual health as a right. Joining me today are two people working to change that. Mikaela, founder of Divine Drops, creating sustainable menstrual products and training programs for girls and women. And Neville Okwaro, a gender, youth inclusion and WASH specialist who works directly with communities to break down stigma and improve access to water, sanitation, and dignity. Together, they're going to show us that period poverty isn't just about products. It's about justice, policy, education, and voice. Let's begin, Mikaela, with you. Could you tell us a little bit about yourself and Divine Drops and what inspired you to create Divine Drops?
Absolutely, Dina. Thank you so much for having me here today. There has been so many moments that was like, this is what was meant to be. It's hard to wrap it into one, but I think it's when it started to affect me naturally. Whenever things start to affect us, it becomes more highlighted in that way. And I was a nurse. I had everything I needed, but I was working night shift. I didn't understand my cycle. Honestly, I fought it every month that it came around. I was in a battle with it. And it was then that I really saw the impact that this had on my life, and I was able to relate to so many of the other women that I had as patients in the hospital, combined with medical mission work, travels, and it just kept coming up that this is a huge issue that is impacting the health of the whole woman and the community.
Yeah, and was there something that was there a story that kind of hit home hard that made you think, okay, I need to really do more about this? And, was kind of the driving force behind
Yeah.
Divine Drops.
For sure. There were so many little crumb trails that led to this moment, but it was 2019. I'm a registered travel nurse at this time, and I'm miserable. I'm making the most that I've ever made. I'm in my 20s. I should be just like on the top of the mountain, but I was not. And so I kind of went on my eat, pray, love journey, is what I like to call it. And I went and traveled overseas for the first time. It was about an 8-week trip. And while I was there, I was volunteering at an orphanage in the Philippines in one of the stints. And that's where it really all changed of like, no, you have to do something about this. I just got to have such intimate conversations with those girls, and I realized how normalized it was for them to miss school. And so I saw that, like, while my layer was affecting my life in a big way, I wasn't without products and missing things and just totally like isolating myself from society during my cycle. And these girls were beautiful and they wanted to be nurses and they wanted to do so many big things. And I thought, wow, if they're missing school a fourth of the month, 5 days out of the month, like this is going to stifle so many opportunities that they have going forward. It caused me to dig deeper. I started asking the school and the staff, how many days do the girls miss the boys? It was a massive difference. And so I was like seeing it and then saw the numbers and thought, like, who's questioning this?
Yeah. And could you tell us a little bit about Divine Drops then and what you and your organization does?
Yeah, so that was 2019. Imagine I can't get this off my mind, and then COVID happens, and it was just that catalyst moment for so many people. And I'm working out in California, and I end up being like quarantined for almost a month, like two different 2-week stints. And I'm like, have all this time. And that was what was on my mind. That was what stayed on my mind. So officially in 2021, we registered as a nonprofit, and we've been going for the past 4 years ever since then. But I like to tell people that I help girls and women feel more confident around their cycle. I think period poverty is a huge issue, but there's also poverty of mindset, of these taboos of education that is going on that's also affecting this as a whole. And so that's our goal, is to really help girls and women feel more confident. of their
And it's amazing the work that you do, and hopefully we'll get a chance to sort of dive deeper into some of the work that Divine Drops is doing. And Neville, really welcome and thank you so much for joining us. It's such a pleasure to have you here. Obviously, today we're really here to talk about girls and women around menstruation, the issues around their health, and what the barriers are for them. But tell us a little bit about your background, Neville, and sort of what was your pivotal moment and why you wanted to sort of join the workforce of helping women and girls around menstruation.
Thank you so much, and it's a pleasure for me to be here. Um, I, I will always say that I never chose menstrual health, but menstrual health chose me. Because I was minding my own business. At that time, I was on secondment at the Ministry of Health in Kenya. At that particular time, I had someone speak about menstruation and menstrual health, but just wished it away. But my turning point came in 2015 when the ministry chose me to go for some menstrual health training in India. By the time I was out of that training, after the 7 days, I realized that everything I knew about menstruation was basically a fallacy or a lie. Misconceptions that I will continually perpetuate. And when I came back to the country, by then I felt so stupid. I felt like I thought I knew so much, yet I never knew anything. And from that particular time, my desire has always been to look at, or rather to find men who might feel as stupid as I was, just to show them the light that this is a natural biological function of the body. So from that time, menstrual health and I have been going stronger each and every day.
Yeah, that's incredible. And I think Mikaela and I like nodding our heads. And I don't know about you, Mikaela, but like for me, I think, it was actually, personally speaking, it was the same for me. So my parents are sort of Middle Eastern, and there's a lot of stigma around menstruation. And I personally wasn't told too much. And I also was extremely ignorant. There's a lot of lack of education, right? I think that's the start, but then there's so many more layers to that, as Mikaela was alluding to. But education, I think, around women's bodies is probably the starting point of where I'd like to start us off in discussion. So, Neville, if I was going to ask you, what does period poverty really look like to you? What is that?
In most cases, when we talk about period poverty, one thing that I've realized is that we tend to focus more on menstrual management materials and per se single-use products. But one thing that I've realized is matters menstruation go beyond that. Like in my country, we have different communities and we have so many stigma and taboos around this subject of menstruation. We also have misconceptions about menstruation, and we also have so many beliefs that obviously are going to hinder girls' mobility and also approach to how they manage their periods. A case in point as something that is so simple that if you go to a vegetable garden when you're on your periods, the whole vegetable garden will wilt. It is something that is perpetuated up to today. Even those who've gone to school, university, you'll hear them perpetuate the same. So issues of lack of education and awareness, to me, still falls amongst the greatest contributor of period poverty. Then obviously, having access to affordable, available, and safe menstrual products and services. For example, it is a matter of promoting choice. If by any chance I would want to use, for instance, a washable pad, am I able to get it at that particular time? So that is partly some of the work that we've been engaging just to ensure that we promoted choice so that people are able to use the menstrual products of their choice. And also something that sometimes we neglect is we also have facilities that are good enablers for menstrual practice. In my country, unfortunately, you'll find that even access to simple things like toilet and washing facilities becomes a big challenge. And compounding even the problem further is access to disposal facilities, whereby you've used your menstrual product. How do you dispose of it? So in most cases, you'll have to, at times throw it into the pit latrine, um, and if not, throw it into the sewer system. Obviously, it's going to cause blockages. But also, the worst of it all is that you have to carry it home. So even if you are at your place of work or even school, you have to carry this menstrual product back home. So period product period poverty basically then goes beyond just looking at menstrual products, because menstrual products might be there, but one of the fundamental thing is, how do I use this product? Allow me just to give a case in point, something that someone told me in one of the slums in Kibera. um, so the government normally distributes free sanitary pads to girls in public primary schools. So this girl got a period product, but she had not started her periods. So when she started her periods, she was in school. She carried that. She will always carry a sanitary pad that the government gave. But this particular time, when she started her period, she put the sticky part facing the vagina, because no one had told her how even to put on a pad. So it affixed to the pubic hair, and she had to go to the staff room for the teacher to help her, just to remove it with caution. So she had the product, but one of the fundamental things that she lacked was that education on even how to use the product. That's why, if I'm given an opportunity to rank, I'll rank education and awareness as number one contributor of period poverty.
Thank you. That's yeah, that's an incredible story. And I was recently in Kibera. I also gathered quite a few other stories, which we'll talk about later, I think. But I would agree with you that in my work in the humanitarian realm for 20 something years, I think education is always going to be the first starting point for sure. And that's something that you as well, Mikaela at Divine Drops, work very hard to do. Tell me a little bit about what women and girls tell you that they struggle with the most.
It's got to be the taboo. It's got to be the fact that they think that this is a dirty process, that they don't see it as a connection, as a part of the creation process, the ability that we get to have this beautiful creation of life and carrying on the next generations. And it's through this cycle that happens. So there's a huge disconnect there. And I think when that happens, you are disconnecting from your body, from source, in some kind of way, because why would this be a gift, if it's caused me so much pain and hindrance? And so much of that does go back to education, but it's to me at like a core, like inner who am I kind of level.
And so let's talk about stigma a little bit, because that's absolutely right. And Neville mentioned it earlier, and it's huge stigma, no matter where you are in the world. Like here, even in England, they have horrible terms for when girls are on their period, like you're on the rag, you're, Auntie Flo's visiting. It's just always, and it's something that people here just don't feel comfortable talking about. They just simply don't. How does stigma show up in everyday life for women and girls in Kenya? So Neville, could you sort of give us a few more examples of, you mentioned one about going into the garden and, if you're on your period, all the vegetables will die. But I remember the secretary telling me in Thailand, well, now you've got your period, you can't touch any man because you just can't. So don't touch any men. And I was what, 13, 14, finding this very confusing.
Yeah, like what could happen if I touch a man right now?
Yeah, what's going to happen? I was terrified. So could you tell us a little bit more about, like, how does that show up in schools, in homes, in workplaces? Like,
I think at times we concentrate so much in schools to a point that we even forget social settings, um, and the home. For instance, in most communities, it is believed that when you're on your periods, you are not supposed to, for instance, serve your father, or even others go as far as you are not supposed to cook for your husband, um, or else your husband will die. And I always say, then all men will have died in Kenya by now.
As you're saying.
Yeah. Um, when you go to places of worship, you'll be told that when you're on your periods, you cannot get into a church. And I saw that firsthand. By that time, I never knew what menstruation was. So I've gone to a church, and I found so many women just at the door of the church, and they were seated. So I'm asking the person who invited me, why are these women here? Then I was told that they are unclean. When you say it in my mother tongue, it comes out so um, awfully that they are unclean. Already, it's like you're telling these women that you cannot attend church when you're on your periods. Then some of the areas that I've realized that we do not talk about such cultural practices and cultural beliefs, yet they hurt women to a great deal. For example, some communities believe that when you're on your periods, you cannot attend a funeral or even a burial because you'll bring more deaths to that family. At the same time, I found a community in Kenya that believes that when you're on your periods, um, if by any chance your husband dies, that is, rather your husband has died before your next period, you are supposed to sleep with a man, and not just a man. They'll look for maybe a lunatic or some drunkard in the village so that you are cleansed before your next period. Um, uh, Apart from that, when some of the challenges that we have managing menstruation, even within a school setting, your menstruation is supposed to be a private matter. I'm not supposed to know how you manage your periods, be it my daughter, be it my wife, or any person, any menstruator that is related to me, simply because that is what has been passed from one generation to another, that it's supposed to be something private. But also, this lack of education still goes back then to women. Um, uh, in most African settings, women are supposed to pass cultural beliefs and practices from one generation to another. And that has been vested on them. So they'll continue to pass these retrogressive beliefs from one generation to another. So it's just even a matter of gender stereotyping and also the unequal power relations that even come to play during matters of menstruation. So it's going to affect girls because you can't speak about it. And the worst of it all is that even when you face pain, when you're having menstrual disorders, you can't tell anyone about it because it's like you've taken a vow of silence. You've been told that this is something we do not talk about. So in the long run, still continues to affect women and girls, even in Kenya.
So I have a question to both of you. Now, we know that when a girl starts her period, that means her body's working well, right? It's her body saying everything's good, everything's going well, and you are going to be able to, be fertile, hopefully, and have children, right? That's the process. So it's why do you think there are so many taboos and stigma around this when we know it's something that really should be celebrated? And some cultures, they do celebrate it. So some Arab cultures, they will absolutely, hold a period party, in fact, to celebrate. Some Native American cultures in Ghana, I think there's some people that do. So it's like in certain cultures, they will see the absolute flip of this, and it will be something that is, talked about and celebrated, and the girl is given, I think, a moon party in some cultures. But why is it that really in so many parts of the world, this wonderful thing that's happening, this thing that really should be celebrated, isn't? Do you have any ideas around why you think that is?
In just the shortest form, I think it's because it's so powerful. It's so powerful that to some it's intimidating, and if you don't understand it, what are you going to do? You'll create things that will make it not so powerful. And then you add this layer of silence on top of it, and we can't dialogue and ask these questions that say, why? Why are we thinking this from this super healthy process? Because back to my starting story, that was one of the pivotal moments. I lost my period for like 9 months in a very fertile time with no birth control, none of that. Like my cycle was just off. And I went from hating it to going like, wait, where are you? Come back. What's wrong? It was startling in the opposite sense as well. And so that was when my relationship changed with it a lot, because as a nurse, it is a major sign of health, and we call it your fifth vital sign. I do, at least. In the hospital, we don't always carry its importance that it has, but it holds a lot of messages for our health.
So, Neville, let me ask you, when you hear some of these rather harmful myths, how do you approach it? What do you think? How are you going to tackle that in that community? What
Uh,
options do you have?
y- so in most cases, one of the things that we've always done um, when conducting any menstrual health training is to start from puberty.
Mhm.
We are safe starting off from puberty for people to understand the body changes that a child will go through until they get to puberty. What are some of the changes that they experience? The same to even a boy. And even while in community settings, we'll get to a point for them to tell us the landmark change for girls, which is menstruation, and landmark change for boys, which is basically the onset of wet dreams. Um, and we'll get to concentrate more now on the girl, because the community has already alluded to the fact that this is natural, meaning whatever happens in boys is natural. In the same way, whatever happens in girls is natural. Uh, so that is where we always begin that discussion, just to dispel some of these myths and taboos. So we'll work with the community, and in most cases, we always want we act as more of facilitators of that particular process and not the ones to give the information. So that in the long run, if there is a group that normally would be so upbeat about even trying to discourage some of these myths and taboos, I've always found them to be men. Because here comes a case, this man has never been taught anything about menstruation, totally. And they get the information and realize uh, their responsibility towards even breaking some of these myths and taboos. Because in Kenya, however much things have changed, we, especially in the rural settings, we are still more patriarchal. And what that will mean is at times when a man says something, it is taken with a lot of clout, as opposed to um, when a woman goes to talk about menstruation, they'll be told those are issues of women. So we've always been looking at who are these allies that we can work with, but also at the same time facilitating a discussion within the community for them to just dispel some of these myths and taboos.
Who in the community are the ones that, especially in Kenya, are sort of accessing women, girls, boys, like which community members? And if you were sort of someone working for a Ministry of Health now watching this podcast, or you were, a doctor in a clinic, who are the people that are really out there connecting with everybody so that, this is where we should kind of target this kind of behavioral change information campaign?
Community health promoters. Initially in Kenya, they were called community health workers, because these are the people that um, are with the community each and every day. For me, I'll go there once, look at their work, then leave, go to another community. But for them, they're with the community each and every day. And the moment they have understood what needs to be done, then obviously that is the information they pass to the community. So I will actually vote for the community health promoter, because I've also worked with them at scale. just to ensure that we've passed the right information within the household setting.
What would you recommend is the age that these community health workers or schools or parents, what age do you start to educate around puberty?
That is a question that at one point I posed to the Ministry of Education in Kenya. Because for us, right now, for them, it's about 10, 11 years. But we felt that age is actually, they're already a bit older. And based on the challenges that we were seeing within the community, when you get to a point that you get someone who is 8, 9 years old pregnant, happened recently, then there's a problem. When you hear that someone at 8 years old has had her periods, then there's a problem. One of the governor's wives, former governor, at one point told me that her colleague had a child who was about 6.5 years, and she had started her period. Then, to me, I was at a loss just to explain what is happening. And she told me that when she started her periods, they were a bit heavy and painful, to a point the mother used to cry and felt like, why can't I be given this for me to carry for my daughter until she's of age? So we had recommended that we start this education at about 8 years old, when they're 8 years old. But the ministry said no, that is too early. In fact, if I were to decide, maybe we would have even started at 7, but that is still too early according to the ministry. So what we settled on was 9 years, but I still feel, if possible, we could go a little bit lower, because right now, based on environment, based on so many other factors, girls are starting their periods a bit
Earlier and earlier, yeah.
Mikaela, do you want to talk about that? Is there any, why are girls starting their periods earlier?
The biggest thing that I see with that is a hormone. Obviously, everything comes back to a hormone imbalance, but there are so many things in our environment that mimic estrogen when they enter the body. And so we call them xenoestrogens. And so it can be anything from plastic to chemicals to there's even like birth control in the water, right? Because of the way, it doesn't get filtered out the way they say there's antibiotics and things in the water. So a lot of the farming pesticides and chemicals that we use for spray and body wash, all the things that just absorb, they mimic estrogen. And I think that estrogen dominance is got our society in a lot of different troubles, even to me, the like rising of cancer, because estrogen makes things grow. And so it takes a girl from being, before puberty out there and stuff to then she grows, right? And it's through that process of estrogen. And so it's something we're seeing here in the United States as well. And it's hard to shift those perspectives of like, no, not my little girl. We can't talk to her about that. But if we don't catch them beforehand, there's a trauma there. You go from like going into it to this is something to celebrate, this is normal, this is da da da, to what is happening to me? Like you said, do I need to be in the hospital right now? Am I dying? And so the difference in those two experiences makes such a lifelong impact, I think, on how people see their period. And we have to work backwards then if we don't catch them beforehand.
If you're listening to this today and this inspires you and you want to do something to help, here's how you can help. Like, share, send this podcast to all your friends, all your community, and consider donating to our campaign, which is the Big Give campaign. Every donation that you give is going to be doubled so that we can make medical movies that will educate girls and women about menstruation and about the power of reusables. So we've really spoke about stigma, we spoke about the silence, we spoke about the harm that could cause around that, we've spoken about education and who are the best people to target, parents, teachers, community health promoters.
Men, that was a big one, yeah.
big one, yeah. And in your experience, have you got success stories of any programs that you've run where you've integrated, girls and boys together? And has that been successful or, any learning from a joint program like that?
In most cases, what has worked for us is um, we normally target boys and we also target men. But one of the things that we'll always do is we'll have them separate at first. We'll separate them, talk to the girls, talk to the boys, then bring them back together. Because out of experience, we realize that when you talk to both of them together about menstruation, in most cases, it is the boys who talk, not the girls. Until much later is when the girls start opening up. And that much later, in most cases, you find that maybe the session is ending. So it still boils down to how we've been socialized. We are not supposed to talk about menstruation. That is what the girls have been told. So here comes a case, you put them together, and all of a sudden, that is the first topic that you want to talk about, something that they're not supposed to talk about. The program that I implemented, the USID program that I was in, we used to go to the community, and that is the model that we'll use. And within about 7 months, we were able to sell menstrual products worth about 38,000 USD, simply because men were buying more. The moment they have understood that this is something natural and there is a role they have to play, then they are the ones who will place orders. They are the ones who will ensure that they have bought most of these menstrual products. Yeah.
Such a powerful example of how this is not us pinning, against the men, or it's nothing of that nature. It's just simply like misunderstandings that happen then along the way, and in the way that some things are not always an equal playing field. But I have the same experience when men know, they're like, yes, 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 especially on the reusable ones, because they manage the budget and they're more practical and they can see, hey, this actually will last longer and be better, et cetera, et cetera. And so it's just interesting, the crux of that, where it's like the silence and that men aren't supposed to talk about it, but yet they're the financial decision makers in buying the right products or making sure that the right food or enough food is around depending on where they're at in their cycle or pregnant.
Yeah. And I think, one of the things I want to talk about now is sort of pulling this towards what we're hoping to achieve is creating these educational videos around reusables. And especially we're focusing first in Kibera, but hopefully also in other parts of Kenya through our other partners. But one of the things, I was there just last week, and one of the things that we discovered is yes, the girls are missing schools and this is terrible. And yes, they're also suffering mentally, from all the various reasons that we've discussed, the stigma, the silence, the lack of education. But also there's something a lot more worrying, which is sort of more to do with their risky behavior. So when these girls are not able to access sanitary pads that are disposable, they are, and they were speaking very openly about this, having sex for pads and resulting in some cases of pregnancies. And obviously that, this is a form of child exploitation and very, it's heartbreaking. Have you heard such stories, Neville? And this is, something that you're also aware of.
Yes. I've had such stories. And um, uh, partly what we were implementing in Western Kenya, that was made to be very common. We were informed that it's somehow common and mostly based on the poverty levels within those settings and even within the informal settlements. That is something that happens. I think one of the studies that really informed the whole world about sex for pads was done in Kenya, in one of the counties in western parts of Kenya. Even though the researcher said that this was just to whet people's appetite because the sampling frame was a bit small, but at least it will show that there is sex for pads. That if by any chance I cannot afford, then the next thing will be, this is something that is so important to me, and that to a point I'm able to sleep with someone to get some money to buy these pads. But also at the same time, um, some have been lied to, so they get into sexual intercourse simply because they do not understand what is happening to them. I know of someone that contracted HIV simply because she was lied to that when she has sex, this will stop, and in most cases that normally stops for 9 months, then it's back. So she got pregnant, but also at the same time um, contracted HIV.
That was really distressing to hear, especially because, as I said, we have solutions, right? There are solutions. Mikaela, talk us through the various reusables that are around and which ones we're focusing on for Kenya and why.
So, Divine Drops, we have three different options because, like you said, Neville, choice is so important in this. We educate and then we want them to have choice, and there's dignity in choice. But we have reusable pads. All of these last 7+ years. The menstrual cup is rated for about 10 years. But there's the reusable pads, the period underwear, which is going to combine the pad essentially with the underwear, because that's also something to consider. You might have a pad, what are we putting it on kind of thing. And then there's the menstrual cup, which is going to mimic most similarly to the tampon. That one does require more hygienic situations, because of insertion and needing to clean. But we're focusing on the exterior ones, the reusable pads in this scenario. And that's because they're going to grow with the girl. If we're trying to get these girls at this really young age and say they need like a small underwear at this time and they end up needing a large, within 3 or 4 years, that pad will work, will grow with the girl and have that longer lasting solution. So in our international efforts, we typically focus on the reusable pad, but depending on the setting, we also talk about the menstrual cup. And we're working with a company now that's actually working on creating a sanitary solution, like a pod that uses very little water, and can clean the cup in different scenarios. And so all those things have to be considered, right, with the wash facilities and the water access and stuff. And there's a huge stigma around how much water is needed to clean, something like this. And essentially, it just requires some really heavy rinsing at the beginning, and then you're just doing it like the rest of your clothes. It's nothing that requires this intense amount of water to wash. But they're so much better for the body. They're so much better for the environment, and they're so much better, especially in these scenarios where girls don't have a way to throw them away. The stories that I've just heard around what they need to do to dig holes, or they're out late outside the house trying to burn a wet pad they used that day very unsuccessfully. I was at a school in Tanzania where they had the incinerator, I think is what they call it, but it was right by the classroom. So they're bringing like their pads there to burn and then like breathing it in some kind of crazy way. And so when you think about all of those different levels, the reusable pad is, I think, superior. Reusable solutions are superior. And the biggest point is that it shifts the mindset. Like, this is not dirty. We can touch it, like, how does it look? How heavy is your period? The clots, what color? All these things that give us these signs of health. And I think the more that we can just shift the perception of it, we can simply decrease so many of the symptoms with just reusables and shifting the perception, because we all know how powerful the mind is in these scenarios. And if you think this is a curse, that it's disgusting, that it could kill somebody, all the things that we've mentioned today, you're going to have more pain. You're going to resist it to higher levels. And that resistance creates a lot of suffering that kind of, I think, just confirms the belief that this is bad, because it hurts and things like that. So just all of that's tied in together.
Yeah, absolutely. And I mean, when we did a small focus group, and I'm sure Never, you've got so much more to say on this matter, but just the small sample of girls that we spoke to were aware of reusables Absolutely. But did they want to use them? No. And one of the reasons is because they don't want to touch their own blood. So the washing process, because of the stigma around it. But all of them acknowledged that the idea that, yes, if they had 3 or 4 of these, then they would be able to maintain their own, like, they could look after themselves, their own health.
Not needing anybody else for years. Yeah.
They don't need to talk to their mum about it. They don't need to talk to anyone. They can control this. But so what have you heard around reusables, and have you ever integrated them into any of the projects that you've worked with Neville? And do you have anything to share on, any success stories or any negatives around it, and what your thoughts are generally around promoting reusables?
We've actually been heavily involved in promoting reusables because we are promoting choice. And while doing that, one of the things that we've also been looking at is how do we provide that user education? Because giving a girl a reusable or rather washable pad without education is like you've given someone a phone without a charger. And very soon the charge will run out and this person cannot use it effectively. It is important for girls and women to be taught how to maintain that particular menstrual product. So what we've done in the past, especially when I was implementing this market-based approach to menstrual products that really sought to promote the uptake of menstrual products and services, we looked also at the washable pads and menstrual cups because they were not so much known within the locality that we work in. It was basically 8 counties, but predominantly rural. So what we will do is we decided to ensure that we actually gave user education through the CHPs. We gave them products for demonstration. And one of the typical things that will always be told is the usual things that I can't wash my own blood. You realize that in most cases that is more of a practitioner thinking, and also for those who are talking from a position of privilege. Because in most communities, girls and women have been using rags. And still, they will wash these rags and maybe use them for the next period. And basically what we've done is how do we then make quote unquote these rags safe for you? So that is introduction of a washable pad, so that they are able to look at it from the angle of affordability and what have you. So it's so important that then we focus also on, as we promote choice. You cannot promote choice by only looking at single use products, but let us give information about all these products. Then girls and women will make an informed choice. But even as they make informed choice, there are also other factors that they will tell you. What about water?
Yes.
What about drying? Because if by any chance you cannot put your maybe even innerwear to dry in the sun simply because I'm not supposed to see your innerwear, what about a menstrual product drying in the sun? So it means it still boils down to one thing: education, education, and education. Without that, there is nothing much that we'll be able to achieve.
One of the things I want to sort of end on is really putting this together now in terms of what we're trying to do with the Big Give campaign and with creating media content. Because touring around Kenya recently, one of the things that we definitely saw was a lot of people have access to phones, and a lot of girls are being influenced on TikTok and on social media. And, what do you guys think about that? And do you have any other ideas of film-based content? Animation as well works brilliantly too, that we could create to really help work with these organizations like Divine Drops, SOS Children's Villages, the Ma Trust, and other agencies working in Kenya, and the Ministry of Health, to really help them promote this work and promote the story of reusables?
I think so much of this stuff is perception. It's like if we can change the way humanity perceives the menstrual cycle, then it would all just get flipped on its head. And same with the reusable options. It is the elite option. It's more expensive, it's better for the body, there's less this, there's less that. So to be able to shift that too into being like, no, I have the best of the best right now versus this product that's filled with chemicals that if I wear too long is going to give me rash and irritation and all of these things. So that comes back to education, but it comes back to perception. And you had asked earlier about program stuff. For us, it's so important like to talk to the girls, but also we have a program for OBGYNs because they're not even as versed on these things. So imagine you're a girl and you're going to talk to your doctor about something and they're like, "Oh, I've never heard of that," or "I don't know about that," or it's like, what? The message has to be congruent. And even in school systems here, we were having trouble where we were talking to the girls, then the girls were going home to their mom, and their mom was like a wall, "We don't talk about that." Da, 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 da. And so it's just like, where are they going to then go with this information and get met with like resistance because they're also, and so then it just doesn't connect. It doesn't make sense. But I'm so happy that we have Noble here
Yeah.
to talk to because you work with these community health people.
Mhm.
How can we support what you guys are doing in educational efforts and really focusing on promoting these reusable products and the perception shift through education and cultural, taboos and just talking about it?
Mhm. Yes. I love what you've said, what both of you have said,
Mhm.
especially looking at the place of education in fighting stigma. And I always mention that when uh, we knew about HIV/AIDS in this country, there was a lot of stigma around it. To a point, people believed you cannot even shake hands. You can, if you meet any person who is HIV positive, then you should not even be in the same room, etc. But then people started talking about it. Media talked about it. Government talked about it. The NGOs that were working in that space talked about it. There was lots of information around matters of HIV and AIDS to a point that we normalized that conversation. And I strongly believe that we are also able to normalize the conversation on menstruation, right from um, working closely with the media, working closely with um, influencers, working closely with the community health promoters who will ensure that this um, teaching is able to go right up to the household level, because that is where basically the action and also the challenge is. Um, we've actually done this before, and what I love about the addition is the visual um, um, sort of program that you are bringing in. We never had an opportunity to make short videos. So instead, what we are doing is we are using more of an A3 booklet.
Mhm.
But you can imagine if you are able to get these on Twitter, if you're able to get the on TikTok, if you're able to get these on Facebook, and even
With girls that look like you, that speak your same dialect and stuff. Yeah. Mhm.
and short snippets even that can be shared on WhatsApp, because in this
Absolutely.
country people also love WhatsApp. Another thing that I love what you've done is using the local language.
Mhm.
So when we were starting off, the material was in English, and we will go out there, we will train the public health officers and other officers who then will cascade this training to the CHPs. So the community health promoters will always encourage them to use the local dialect. Whether I was understanding or not, that's not the issue, because we'll go for the frequent monitorings that we had. But even that time, you'll find them, they'll want to switch to English or Swahili. But I will always tell them, no, use local dialect, because there's a way local dialect really gets into people's mind to a point now they appreciate whatever you're talking about. Further still, maybe also consider looking at people with disabilities. How can they also get this information? Those who are visually impaired, those who are hearing impairments. Um, I met someone who is autistic and told me that for her, one of the things that she was really looking forward to is her menstruation. But you see, the art parts paint menstruation. At that time, they will use blue color, not red.
Right. That I think
So
you're right.
for her, she
That's
was
around the
waiting.
world.
Yeah, for her, she was waiting for blue, but what came out was red. So
Oh
she could
my.
really understand what was happening.
Mm.
So um, uh, I think there is still a lot of education that still that needs to be done, and
Mm.
we do not leave anyone behind while we are crafting these education messages.
I want to thank you all. I think we're going to wrap up, but I would just like to say, I mean, if there was if a government leader was forced to listen to Her Body Matters podcast, this podcast right now, what would you advocate? What are the, your top 3 things that you would advocate for in regards to our discussion today?
Number one is education. Um, there is a way. Matters menstruation is already in the curriculum. That we are supposed to be taught reproductive health, but it is not deliberate and intentional. So I think it's important for us to really look at how do we include puberty, growing up, and matters of menstruation in the curriculum. Then secondly, the government has a free sanitary pad distribution program. That is good. But I would rather they look at making menstrual products, all menstrual products, affordable, available, safe, and accessible. Because distributing free products is not sustainable. Then, thirdly, um, I think it will be so important for us to pause, take time, and listen to the voices of girls and women at the community level. Some of them, maybe even the challenge is not the menstrual product, but we might be, even as government, busy promoting that. So how do we marry matters of policy and tamper it closely with the situation that is on the ground, that is the voices that matter the most? So for me, those are the 3 critical aspects that I feel government should be looking at.
Thank you. And then, Michaela, from your side, if someone's listening today and they want to help, what would you advise them to do? How can people help?
First things first is speak life over the cycle and over the period. I mean, it costs nothing, but when it comes around, speak life over the process that it is and the ability that your body has to ovulate and go through those things. Secondly, educate yourself because in everyday conversations, we talk to other girls, we talk to other women. We are influencers on every level, every day. And I think the more that you can just be that for other girls, maybe something that you didn't have when you were younger, the more that we can share that because people learn from the people around them. I might take, something off of the TV, but if I'm seeing someone in my language or my mom or my aunt, and they're telling me these things, the ripple effect is huge. If you become like that beacon for that community, the ripple effect is huge. And so, education can mean a variety of things, but at Divine Drops, we have a 6-week train the trainer menstrual health advocate. So you can become an advocate and you can have access to reusable products to distribute at a really, really affordable price and have the tools like I have sitting around me here. One that we just wrapped up is like our Flow and Tell card game. And so there's just so many ways to integrate these kind of things into conversations and stuff And then I would consider switching to reusable products and tracking your cycle, because just by doing those two things right there, um, connecting with your blood, it's not dirty, connecting with your cycle and understanding that we have 4 phases and that we are going to not be the same today as we were 2 weeks ago. Just stop trying, stop trying to be the same and understand your cycle and where you're at this moment in your cycle, and really how to best live with that. And I think when we do that, we get into this flow that's so beautiful and so much less resistance. And the people around us are going to say, hey, what are you doing different? And you'll be able to say, I now honor my cycle. I don't hate it. And just that shift is something that really influences a lot of other people.